Hello, everybody. Good afternoon. It is so great to see you here today. My name is Rebecca Andrade, and I'm the Educational Programs Manager here at the Kansas Health Institute. And I would like to welcome you to the 2025 County Health Rankings and Roadmaps webinar. So, a little bit about who we are. KHI, or the Kansas Health Institute, is a nonprofit, nonpartisan educational organization based in Topeka, Kansas. We were established in 1995 with a multi-year grant from the Kansas Health Foundation. And we are guided by the vision that Kansas will become the healthiest place to live through evidence-based and innovative strategies, policies, and practices. We work towards this vision by providing nonpartisan information, convening crucial conversations, and facilitating learning that leads to meaningful change. If you visit our website or you stop by our building, you'll see that our work involves research, evaluation, technical assistance, and policy analysis, as well as podcasts, blogs, and gatherings just like today's convening. So in today's session, we're looking forward to a really great conversation where we'll be able to explore background information on county health rankings and roadmaps, as well as new information about the model and details about how to interpret the data. We will also take a look into Kansas data and county profiles, along with a live demonstration showing you how you can access your county data and additional resources that can support your work. We will end with a Q&A session to address any questions that you have. Before beginning the session, we would like to express our sincere gratitude for all the team members who contributed to this work. This work is a very large team effort, with many contributing a wide range of skills and expertise. So a big thank you to you all. And it is now my pleasure to introduce my colleague and today's presenter, Wyatt Beckman. Wyatt is a senior analyst here at KHI and has been leading our work with county health rankings and roadmaps for the last few years. So you're all in very great hands. Wyatt will be leading today's session, providing valuable information about the data and conducting a live demonstration. Over to you, Wyatt.
Thank you, Rebecca, and thank you all for joining us. And as we kick off our session, I want to reiterate my sincere thanks to the whole team. Today's the start of March Madness, and basketball is a team sport. Certainly, everything that you're going to hear about today is a team effort. So thanks to everyone involved in the whole team. So one of the questions that I think a lot of you all here today may be asking yourself is, how healthy is your county? And how could you work together to make it healthier? And for more than a decade, County Health Rankings has been a really valuable resource to help you answer that first question and give you strategies and ideas and resources to contribute to answering that second one. And today I'm going to walk through what's new for this year, give you an insight into how to access and make sense of this data, and point you in the direction to look at strategies and all the additional resources that's in County Health Rankings. As we begin, I do want to note that a couple of my colleagues are going to be answering questions as they come up in chat. So please, as we're going through the information, if you have a question, drop it in chat. And I'll also would love to see where all you are coming from today. So if you can introduce yourself in chat and say what state and county you're joining from today, I'd really love to see that. So we'll begin with some County Health Rankings and Roadmaps background. So County Health Rankings and Roadmaps is a program of the University of Wisconsin Population Health Institute. CHRNR, as it's sometimes called, or County Health Rankings, provides data, evidence, guidance, and examples to build awareness of the many factors that influence health and support leaders like you all in growing community power and improving health outcomes. The rankings are unique in their ability to cover nearly every county in the entire country, and they provide a range of resources that we're going to talk about today. County Health Rankings is housed within the University of Wisconsin Population Health Institute, and it's had support from the Robert Wood Johnson Foundation. I do want to note our role in this work. So our role at KHI is to support the understanding and utilization of County Health Rankings. We do that in a number of ways. This webinar is aimed at doing that. The county profiles that we'll show you later today help do that. And we also provide technical assistance. So if you have questions or want to learn more about County Health Rankings, you can reach out to us and we'll try to support you. It is important to note that we don't determine the data that is selected to be included in county health rankings for each county. We also don't decide how the model is changed or not changed, which we're going to talk about here very shortly. But we do really appreciate the opportunity to support you all in using this information to guide your efforts to make Kansas and your community a healthier, more vibrant place to live. So with that brief background, let's talk about what is new for 2025. Since 2014, when you've looked at county health rankings and roadmaps, this has been the model that has guided their work and guided your understanding of how health is summarized. This year, county health rankings, the University of Wisconsin Population Health Institute introduced a new model. That new model looks like this. Now we're going to, in the next few slides, walk through each of these components, starting from the bottom and unpacking what this new model says and some of the shifts that we've seen from the previous model. Starting at the bottom, this year in this new model, power and societal rules were added. Now, power is defined as the ability to achieve a purpose and affect change. So people can build community power when they organize and act together to do things like set agendas, shift public discussion and discourse, influence decisions, and cultivate relationships with decision makers or policymakers. Societal rules and how they're created and maintained are referred to as the structural determinants of health, which is the focus of the National Findings Report this year for county health rankings. Power shapes and is used to create societal rules. Societal rules is this new orange section you see. Within societal rules, there are two categories. There are written and unwritten rules. Unwritten rules and written rules together shape community conditions. Written rules examples include laws, policies, regulations, and budgets. And unwritten rules can be worldviews or norms. They can include customs or even expectations that guide behavior and participation, even if they're not documented or written down. It's important to note that this year, with the new introduction of this model, there aren't any identified measures yet for societal rules and no summary score for societal rules or for this section. If we move forward and move up in the model, the next section is community conditions. Now, community conditions used to be called health factors. They kept the color consistent, so if you're used to the blue, blue is still community conditions, formerly health factors. Community conditions include the social and economic factors, physical environment, and health infrastructure in which people are born, live, learn, work, play, worship, and age. Community conditions are also referred to as social determinants of health. This shift from health factors to community conditions really emphasizes the role that all those things in our environments and in the community shape population health and well-being, and is meant to guide us away from maybe narrowly or getting too focused on individual health behaviors, but thinking more about the broader community factors. The weights and categories for community conditions have shifted some from what they were when they were health factors because there are now three categories. Those weights and categories are health infrastructure at 25%, physical environment at 25%, and social and economic factors at 50%. Those weights are used in calculating the summary score, which we'll talk about later. The final section that's updated in the model is only updated really in name. It was formerly called health outcomes, and it's now population health and well-being. It's worth noting that no changes to the categories, the measures, or the weights happened in this update. Population health and well-being focuses on the distribution of health within a community and how those community conditions are interconnected and shape our quality of life and our ability to live meaningful, long lives. So together, that's the new model. And you're going to keep seeing community conditions and population health as we move forward and talk about some of the data. Next, I want to talk about the measures. So this new model, this updated model, informed updates to the county health rankings measures. Within county health rankings, there's two groups of measures. There are select measures, which are included in that summary calculation, included in that visual summary that we'll see later, and are on your county profiles. And then there are additional measures. Additional measures are available on the website, but they're not actually included in the summary calculation. So they're there to use, to learn and guide your work, but they aren't included in that summary. In addition to that, there are some new measures that were added into County Health Rankings library and database. Access to libraries is the only one that is included as a select measure. The other ones are all additional. I will show you where those new measures are in the model. So there are some new select measures. Library access is brand new, but within physical environment, broadband access was added within community conditions. It used to be an additional measure, and it's now been brought up as a select measure. Library access is in the same community conditions area and is a brand new measure. And we'll see some of that data here soon. And then the last new measure is down in social and economic factors, and that is childcare cost burden. So this probably feels like a lot of new things. New model, some new measures, and some of you may be saying, well, I really liked a lot of what County Health Rankings was doing. And the good news is there's still a lot that hasn't changed. Some of the same things that were really great about County Health Rankings have been continued. We still have two summaries. We still have population health and well-being and community conditions. They've been renamed. There are some differences, but we still have those two summary scores or summary views of health in each county. We can still see a relative distribution within Kansas. We'll see how that view enables that here soon. Many of the underlying measures, which is the best way to track progress, are the same. And that enables us to track progress over time, and I'll show you how to do that. And finally, we still have an ability to compare counties at the measure level. Before we get into some reminders about interpretation and see data, I do want to flag a few more additional updates and new features in County Health Rankings website. There's now a national map view that's available in your state snapshot. So we can see beyond just the view, just the borders of Kansas, and see those neighbor counties, compare Kansas to other states as well. Within the strategies and solutions section, there is a new strategy around community organizing. There's also a curated list for structural determinants of health. And another new thing this year is a chatbot that allows you to research and learn more about the What Works for Health strategies on their website in a familiar AI chatbot sort of manner. That's a really neat tool that they've launched this year. Lastly, in our findings and insights section on County Health Rankings website, they have some expanded transformative narrative resources. There's a new podcast series for their In Solidarity podcast, and there's the National Findings Report for 2025 available as well. When we get to the demonstration today, later in the webinar, I'll show you where to access some of those resources, but I wanted to mention some of the additional updates and new features that are part of this year's release. Before we talk about data, I want to give you all some reminders and some helpful tips and considerations to interpret the data the best, most useful way. First thing to keep in mind, the best way to monitor progress is to get to the underlying measure. That's the best way you can see if your county is improving or failing to improve in a particular measure. For example, here is a trend chart for McPherson County and preventable hospital stays. And we can see that trend over time at the measure level. That data can be really valuable to guide work. The next reminder and thing to keep in mind is that when we see these health summaries, these dot charts, they come from a diverse set of measures, a wide, different sources, different methodologies, and sometimes those can change over time. And we will do our best to remind you of where those changes are, and County Health Rankings is good about sharing and showing when there are changes in methodology. Another reminder is that there's always a lag in the data. So when we talk about the 2025 County Health Rankings release, we are talking about data that's often a year to 3 years old. It depends on the data source, and they have a full data year resource showing that. But just keep that in mind. If you see some data and you know that something recently happened in your county and you don't see it reflected in the data, it may just be that lag in data. When we're working with large national data sets, there's always going to be some data lag, and it's not a flaw. It's just part of pulling together and making sure that data is available and as accurate as can be. The final reminder and thing to keep in mind is that for some measures, when you see that final number, it is pulling together multiple years to create that one data point. So it may not align perfectly with just the most recent year, but is pulling multiple years together. With those considerations and reminders in mind, let's dive in to thinking about the data and how they got there. So I mentioned the updated model. So here's an overview of how County Health Rankings creates these dot charts that you're going to see. So they updated their model. That model guides updates to measures and weights. I talked about some of those new weights for the specific model category areas. They find the data for all the counties that it's available, and they calculate composite scores using z-scores, a way to standardize different data sets, and those measure weights. Once they have those composite scores, they then identify health groups. And those health groups then are shown in color format in health summaries or dot charts. So let's talk about those health groups. These health groups replace what used to be a numerical rank. So we don't have that X county is number 40 anymore. We now have these color groupings. There are 10 data-informed groupings, and it's done across the entire US from least healthy to healthiest. And you can see the color range for both of our summaries there. If you are a county in a particular shade of green, all of the other counties that have that same shade have similar composite scores. So it allows us to see counties that have similar performance or similar population health and well-being or similar community conditions. A final note is that these are not equal size. So we don't have the same number of counties in each of these groups. There are fewer counties at the far end of healthiest and fewer counties at least healthy than we see around the middle. So what does that look like on a map? So here is what population health and well-being looks like across the US. You can see that range from dark yellow, least healthiest in US, all the way up to dark green, healthiest in the US. This is that new map view that I mentioned earlier. If we bring that down to Kansas, here is what population health and well-being looks like in Kansas for 2025. Unfortunately, Wallace County in gray was not grouped this year, did not have enough data, enough reliable data to be grouped. In addition to population health and well-being, there's also the same map created for community conditions. And we can see that range from purple to blue for Kansas. When you interact with your data, where you're likely to start for your county is the health summaries. So here's the health summaries. These health summaries, as a reminder, last year these were introduced. They replace what used to be the ordinal ranks. the ordinal number. So we don't have one county 1, 2, 3, 4, 5 anymore. Each county has one of these summaries, or dot charts, as I like to call them. So let's walk through how to read these dot charts. And I'm going to use Ness County in Kansas as an example. Ness County is where I grew up and where my family still lives. So let's look at population health and well-being. First thing you'll notice, Ness County is highlighted and circled there, and there's an indication showing you where Ness County is. Each dot on this chart is a county in Kansas, except for Wallace County, which could not be shown. But the entire spectrum includes all the counties in the entire US that could be grouped. So if we could line up all the states, we'd see counties from all the far left to all the far right. But all the dots you see in this view are counties in Kansas. In addition to seeing your particular county, you're also given the state average and the national average. So with this view, we can do several things. We can see, how is Kansas overall? Where's our state average? And then you can see, is my particular county, where does it fit within the state? And for Ness County, it's similar to the state average, but we can also compare to the national average. And so Ness County, for population health and well-being, has better performance this year than national average. Okay, now it's about time to get into the demo, and I'm going to ask you all to follow along with me and practice reading and looking at the data in your county profiles, and go with me to the County Health Rankings website. So someone on my team is going to drop in chat for you a link to our webpage. And when you pull it up, this is what you should see. You should see a page that shows your county profile. And on the right side, I want you to go find your county. So it's a long list. If you're in Kansas, go find your county. If you're joining us from outside of Kansas, take your pick. I still want you to come along for the experience. So find a county and join us as we walk through these county profiles that our team puts together. So once you get there, and I see that link in chat, so give one more second to get that pulled up, find your county, open in another tab. When you do that, you'll see these county profiles, and here's Ness County as an example. So I want you, last reminder, go to chat, find that link, pull up your county profile, because we're going to now go over to a demonstration. I'm going to pull up a county profile and walk through it with you. And then we'll go over to the County Health Rankings website together and go through how to navigate their website. So I'm going to change this over. And so if you open in chat, so there's going to be two links. I first want you to come to this page. So come to your County Health Rankings county profiles, find your county. I'm going to scroll down, and I will use Ness County again, my home county. I'll open that up, and let's walk through this together. So the first thing you'll see, the very top, you've got your county name, and then we've got those two dot charts. So here's where you start. These replace those numerical ranks. You can quickly see that summary for Ness County. On the left side, you're going to see some notes. These notes remind you of what those dot charts represent and what that continuum is. You'll also see on the left side a QR code and an embedded link to go to the new model. If you notice that there's some new measures or some measures that you used to see that are no longer here, that model will help you understand why that is and where those measures went. Next thing I invite you to do is go to the data table, and you'll see these familiar categories: population health and well-being, community conditions. Come over to the right side and identify 2025. And I think the best way to walk through this is to go to the most recent year for your county, which is going to be right here, and just walk down the page and take note of what stands out, whether positively or negatively. Unfortunately, Ness County did not have enough data to have premature death data here. When that happens, if that happens in your county, on the back end for the calculation of the summary score, you get the state average. But for the purposes of the county profile, if there isn't data there, we don't show it to you. But if we keep going, we can see numbers and we can note that here's one where this stands out to me, 18. So this is percent of adults reporting poor or fair health. And I can do a couple things. I can go left to see how is the trend changing over time. And it looks like it was coming down. Perhaps we had a couple good years in 2023 where it was down, but then came back up to 18. I can also look to the right and compare Ness County, in this case, to the Kansas value, which is all the population in Kansas, or the US value, which is all the population in the US. And unfortunately, this is one where Ness County is not doing as well as Kansas overall. So we can keep doing that and going down the list and see any other data that stands out. This 0 stands out for me. So 0, there aren't any dentists in Ness County. So that's 0 per 100,000 population. Some of these measures are going to be rates, some are going to be percentages. So just pay attention to the note on the left side. You'll also see that some of these measures have some extra notes attached to them. That's reminding you if there are measures that we don't have prior year's data for, or ones where there was a methodology change and it's not appropriate to compare year to year. So we blank those out so you don't misinterpret them. If we keep going, now let's go to the back page. And if you had this printed out, I would be circling, I'd be highlighting, I'd be making notes to talk about with my colleagues. On the back page, here's what we call the drivers. So we wanted to support your work in highlighting 5 factors that are having the biggest impact on health in your county. So these are the 5 factors that, based on the performance in that county and the weights assigned for those measures based on the model of health, have the biggest impact, whether positively or negatively. And we've got the familiar population health and well-being in green and community conditions in blue. Here on the back page, we have 2 different things that help us put county value in context. We have the US county average, which is an average of all the county values in Kansas, or across the US, not just in Kansas. So the US county average. So all the counties, we take an average of their value. And then the direction of impact tells you whether your county is doing better than that US county average or lagging behind. And we can do something similar here where we can go scroll down and see what stands out. So here in health outcomes, we can see that 7.5% low birth weight is better than the US county average at 8.4. If we go down to community conditions, however, something that stands out in a less than preferred way is injury deaths. 176 is higher than what we see US county average. So that tells us that maybe that's an area that could be of focus. But we also see some areas where there's some strengths. At the bottom of this page, you're going to find some notes and some guidance on interpretation, as well as some links to methods and measures information. And at the very bottom, there's a QR code you can scan or a link that you can click behind it that will take you to the What Works for Health section on the County Health Rankings webpage. So that's your county profiles. We really invite you to print those off, to take them with you to meetings with colleagues, to coalition discussions, to conversations with your elected officials, to better understand your community and guide your collaborations together. I now want to take you over to County Health Rankings website and show you some of the additional information and resources that are there and how to navigate that website. So I'm going to click over here, countyhealthrankings.org. You can also click this link here, or there's a link in chat for you, but please come with me over to County Health Rankings So when you get there, this is the view you're going to see. There's a lot of places to start or ways to get into the information once you're here. My recommendation is to get to this landing page, just scroll down a little bit, and you're going to see this search bar. Enter your county or the state that you want to start with. So I'll start with Kansas. So if I just enter Kansas, I see list of counties here as well as the state. I'm going to start with the state. So let's click on Kansas. And here we have the Kansas snapshot. So if we scroll down, this tells us at the top what view we're seeing in the map. So this is that population health and well-being summary. And here is where that national toggle is. So if you'd like to see a national view, here's where you can see that national view. But I'm going to go back to the state view. So go state, and I can scroll down and I can see a list of counties. If I keep scrolling, I'm going to see those same data measures that you see on your county profile, but you'll only see the most recent year. You'll also see to the right, the US as a comparison. And if you expand any of these carets, you can see additional information, including some trend charts for certain measures. I'm gonna not show any more of the state view because I'm gonna take us to a county view because I think county health rankings, a lot of folks are coming looking for their particular county. So for this, let's pick Shawnee County, which is where KHI's, the Kansas Health Institute's offices are located. So let's click Shawnee County. And there's a couple things you can do. You can click either of these to go to their page. I'm going to start with more data for Shawnee County. So this is just going to take us to the Shawnee County snapshot page. So this looks very similar to the Kansas page overall, but now we're just looking at Shawnee County. So if we keep scrolling down, there's some background demographic information, note on rurality, there's demographic data here. This can be a really nice, quick way to get some of that background demographic data for your work, maybe for a grant proposal or things like that, or just to generally understand community. If we keep scrolling down, we see those familiar dot charts. So here's the dot chart for population health and well-being. If you want to have handy access to this dot chart, they've added this download chart feature. If you click that, it's going to download it as a picture along with some notes. You can save it, come back to it later, but that's a really nice resource. If we keep going down, we now see Shawnee County next to Kansas and the US overall. For any of these measures, as I mentioned, we can click this caret to expand and see more information. I'm going to keep scrolling down and you'll see community conditions. So here's a similar setup, but now we are focused on community conditions. We still can download this image to save it, but there's a couple other things I want to show you here. One of them is areas to explore and areas of strength. So these are toggles that will highlight areas to explore, which is the Midwest nice way of saying somewhere where you could perhaps do better. And areas of strength are ones that Shawnee County is doing well in, or whichever county you're looking at. I'm going to untoggle those for a second and show you another thing. If you see this little icon on any of these measures, that's telling you that there's a trend chart available, and the color gives you a quick indication of the direction of that trend. So if we see this flu vaccination has a green chart, if I click that, it's going to open and we scroll down and we can see this trend over time. We can download that graph. We can also see it as a table. So that's a really nice resource as well. The last thing I want to show you here on this snapshot page. Remember I mentioned at the beginning that there are two types of measures for county health rankings. There's the select measures, which go into that summary calculation that go into the dot chart. There's also additional measures. Those additional measures are here as well. They're just hidden. We just have to click these plus signs and it will expand the same sort of menu, same view for all those additional measures. There's similar resources here. and you can still expand, learn more, see the definition, see the data, have charts for some, but these are not included in the summary, but they are here to inform your work and you can use them. The next thing I want to show you is to take you to the What Works for Health strategies. So if I'm looking at this and I see an area that catches my eye, I see maybe high school completion, and I look at that. Notice here on this right side, there's links. So these links take you to several different things. If you want to see the methods or the limitations for the measures, you can do that here. If you want to map this particular measure, this will open up that map for you at the top, or we can see strategies related to this measure. So this is where we can go from learning more about this, where this county is at for these measures, to thinking about strategies to improve it. And high school completion is something that Shawnee County does better than the US average, but we'll still go there and look at strategies. So if we click on that link, it will take us to this strategy page. And because we came from a particular measure, it's going to be filtered for us on the left side. So you'll see all of this is already clicked to just focus on those strategies that are relevant to that measure. If you want to see all strategies, we can back up and go here, strategies and solutions, and go what works for health will be the landing page. And here you can search all the strategies by keyword. So you could type in tobacco or education or smoking or any thing that's of interest, and you'll get a list of strategies. You can also search by topic, and here is where that What Works for Health chatbot is located. So if you open that, it's going to look like a chatbot page where you can ask and have a conversation, and it will only pull information from the What Works for Health strategies and then give you links to learn more. So that's another neat tool. I'm going to go back to What Works for Health and give you one example of what you'll see in these strategy pages. So I'm going to go, let's look at tobacco use together. So if we go to tobacco use, here we can see some example strategies. So I'm going to open this first one, cell phone-based tobacco cessation interventions. If I click on this strategy, a few things to note here. On the top left, you're going to have an evidence rating. So County Health Rankings has a team of individuals that goes through and reviews the research and the evidence to see, is there evidence that this strategy is effective and achieves its goals? And there's a rating scale that goes from scientifically supported, which is the strongest evidence, down to evidence of ineffectiveness. So you can quickly see, what does the research tell us about the effectiveness of this strategy? You'll also see what community condition this strategy aligns with. You'll see the summary of the strategy here. And if you scroll down, there's a lot more information that you can see, including research about effectiveness, the impact on disparities, examples of implementation, and additional resources and footnotes as well. So a lot of information about this strategy that can serve as a starting point to thinking about what are possible ways that our community could collaborate to make progress on something that we've identified. Another thing I want to highlight is this print strategy option. If you find something and you like it and you want to save it and not have to find it again, that print strategy is a great way to do that. Another way you can do that is to bookmark the strategy. So if you click this bookmark this strategy, it will save it, and the next time you come to community or to County Health Rankings, it will show up here in the bookmark strategies. The last thing I want to highlight here for you is this Finding and Insights tab. So I mentioned before, there's a lot of new resources here. There's webinars. The 2025 report is available here, as well as the podcasts and the blog for additional information. So that's the quick demonstration of navigating County Health Rankings website. One last reminder, there's a lot of ways, a lot of views. my recommendation, come to countyhealthrankings.org, scroll down, enter your county or the state, and start there. And take your time. There's a lot of links, a lot of information, a lot of data. And as you're working through it, if you have a question, reach out to us. That's what we're here for, is to help support your understanding of this information. I'm now going to take us back to some final information before we go to some Q&A. I hope that demonstration helped you feel more comfortable and confident working through County Health Rankings information using your county profile. I want to highlight a couple other data resources that are really valuable, that are unique to Kansas, that you should know about, in addition to County Health Rankings. The first is Kansas Health Matters. They're probably most known for their red, yellow, green charts, but they have a wealth of information, and they're available for free on their website. They have tools, they have resources, charts, maps, lots of great resources. So Kansas Health Matters, if you have not heard about that resource, that's one to take note of and check out. Another one is fairly new, and it's All Things Kansas. It's part of the K-State 105 initiative. And as you see on the slide here, it includes more than 30,000 data layers. So it spreads well beyond just measures that we think about being related to health, but it also includes lots of health-related measures. And it's a really great new resource with some mapping features and some report features as well. So I wanted to make sure that if you haven't heard about that, All Things Kansas or K-State 105 is the place to see that. I did want to share, and we will share soon in chat, that we have a resource guide. So we want to ensure that all the things we talked about today, that you have access to those resources, so you can continue exploring your county's data and exploring the strategies and the resources. So in the chat, you will find, it just got dropped there by Lindsay. You'll find a resource guide PDF. I invite you to download that from the chat. And there's a space on the back page as well where you can take notes and some highlights from today while they're fresh in your mind. There'll be some discussion questions that would be great to ask yourself or to ask your colleagues or your organization or your partners, as well as some really helpful links to stay connected with us and our events. We do really value your feedback, and so I want to give just a couple minutes. We spent a lot of time today talking about data and how valuable data can be. So we're inviting you to participate in some data and share your feedback with us. We do really look at this, and we take your feedback seriously to improve our events and our resources and how we conduct these sessions. So please take time to either pull up your phone, it's a very brief survey, and scan that, or click on the link that was dropped in chat. And we would really, really appreciate you taking just a couple minutes to do that for us. I'm gonna keep moving forward, but if you didn't have a chance to scan it with your phone, reminder that that link is in chat. Last reminder before Q&A is to reach out to us. We are here to help support you in making sense of this data and using the resources and the informing your work and your efforts to make Kansas and your community a healthier, more vibrant place to be in. And we would love to hear from you. So there's my email. You're also welcome to email other colleagues at KHI. We'd love to hear from you. So if you haven't got it, you can jot down my email there, or our phone number. You can also find it on our website. So with that, I'm gonna move us to some questions. Have some time here. Using chat or the Q&A feature, invite you to share any questions that you have, and I'm going to pull up the Q&A here and see what we have there. I see a question from John Franco Pacino. Are time trends included in any way in the dot charts or anywhere else in the county summary? No, so it's a single year summary, those dot charts. And then John Franco it goes on to say a single year comparison to other counties or the whole state may mask the fact that overall a measure is going up or down for everyone, which would affect the interpretation of the comparison and the list of strengths and areas for improvement. So it's a good reminder, and what I would mention there to Dr. Pizzino or anyone else that is thinking about tracking progress, the best way to do that, as a reminder, is to get to those individual measures. So on our county profiles, look at the measures over time, see how it's changing, or go to the County Health Rankings website, and especially for those measures that have that icon, the line icon, that's telling you that there is a trend chart that you can see. So that's a way to see that. I see another question here. Am I understanding correctly that the county weighting is based on national data and not Kansas specific data? The method section on the website referenced in Appendix 5, but I couldn't find it. So yes, this was a shift that happened last year and was continued this year. So that summary, that dot chart, is a continuum from least healthy to healthiest in the US. So all counties that have available data for that measure are included in that calculation. When a county doesn't have data or it's unavailable or unreliable, they, in its place, for the purposes of calculating that summary, they get the state average, Z-score. So it does include all US data, but this year, if you do not have data for that particular measure, you get the state average. I see a question here from Sarah. Is there any additional information on the future of CHR&R without RWJF funding? So County Health Rankings has announced that RWJF, Robert Wood Johnson Foundation, has informed them that their funding will end in 2026. So they are inviting people that go to their website to complete a survey to tell them about their resources. At KHI, we are thinking about and working collaboratively with County Health Rankings to think about moving forward what this work can look like in Kansas. And they're thinking about what this work can look like for them. I don't, at this point, have really specific details, but do want to emphasize that at KHI, we remain committed to being as helpful a resource to you all in providing data like this to inform your work and to help us better understand health in Kansas. County Health Rankings and Roadmaps has announced that funding is not going to be there past 2026, and so we're thinking through what the options are to continue providing this information. A couple more questions came in. Question from Julie. Would it be possible to somehow flag which Kansas counties have been assigned the state Z-score in lieu of data specific to their county? Or maybe provide a list of those counties. So a couple ways you can identify that. One is for each of those measures within County Health Rankings, if you go to the website, go to the page, you'll see that those counties are gray. So that's telling you that they did not have information for that county. And I'll give you an example here. Maybe this will help. So you all come back to County Health Rankings website with me. If you did, so we can pull up Ness County here. So if we're looking at Ness County, if it's blank here, then for that measure, they got the state average for the purposes of calculating this dot chart, this summary score. So that's one indication on a county by county basis. If you would like to see for the entire state, you can go to these data sets and download all the Kansas data and see the full list. You can also, in the state view, if we go to a particular measure, here's a way to see all those that are gray, unfortunately, don't have data for that particular measure, so they're going to get the state average for the purposes of calculation. This is also available in a data or in a table view, which you can expand to see that. So Julie, I hope that helped answer a question. I see another question or a comment from Jeff. When we present the data prior to 2024 rankings, we did have the ordinal rankings. How can we show or compare for trends to groups and policymakers? What are some best practices? How to try to compare apples to apples? So that's a great question, Jeff. I'll say a couple things. One, you've heard a few times. Encourage you to go to the particular measures. Use that to track progress, particularly for measures where maybe you've had challenges or you've had successes, and point those out in your conversations. Unfortunately, with the shift in the new model, which is available here, because community conditions has changed and there's new weights and some new measures, you can't compare this year's community conditions blue dot chart to last year's. So don't recommend using the dot charts as a way to compare over time. Really, I think the best way is to look at those individual measures and lean on the county profile as a quick way to give you access to all of those ranked measures and take those into some conversations. But those ordinal ranks have been replaced by those dot charts. Those dot charts still allow you to do some comparison. You know, if we pull up the county profile, we can still see relatively where any particular county is compared to other counties in Kansas as well as the state overall. That's more, you have an additional comparison with comparing to the national average, but I do recognize the challenge of there's not a number to give. A number you could utilize, but it's not provided for you directly, is that health group number. So if we see the map overall, so any county that's in this same shade, that corresponds to a group down here. So we can number these groups 1 through 10, and you could use that health group number. That's still having to do some extra work. So I would lean on driving conversation and discussion to those individual measures and where you can track progress, and then using the dot chart, which is just this year, but still allows you to do some comparison to other counties in Kansas and the state overall. The last thing I'll mention as you're thinking about comparisons, and it's a tool that I didn't mention earlier that is valuable. If I am looking at a particular county, so I'm looking at McPherson here as an example. If I scroll all the way to the bottom, there's this blue bar, big box says compare this county to other counties. Click on that and it'll launch this new view. And this view allows you to identify up to 3 additional locations and put them side by side in a view. So if you wanted to compare yourself to your neighbor county or to state overall, you can do that. So if I come here, I can see those locations. I'm going to add Kansas. Another neat feature that's added this year is you can include all counties with a similar rurality or adjacency to a metro area. And so I'll go ahead and add that. So this would be counties with similar rurality to McPherson, and I'll pick the US as well. When you do that, you now have a customized view of up to 4 locations that you can compare, and any chart that has a trend chart in other views is going to have a trend chart here as well. So we can see those locations lined up here. It's not going to include the rurality group, but if you include other counties, it'll be here as well. So that's another way to think about comparison and supporting conversation. again, sort of gets you to focus or draw the attention to the individual measures. I see we're at 2:29, and I want to be cognizant of everyone's time and remind you to, oops, sorry about that. Remind you to follow us on all the social media channels. Our team at KHI, we do a lot of different things, including the work we talked about today, but we're constantly holding webinars and convenings, putting out new research and evaluation. So please, if you're not on our newsletter, if you're not following us, I really do invite you to follow us on whichever platform is your favorite or all of them. And if you have not been to our website before and today's your first time, don't just stop at the County Health Rankings. Explore all the other resources at khi.org, and I'm sure you'll find some valuable things to support your work. So with that, I will say thank you all. Really appreciate you giving us an hour of your time. I hope this helped you better understand County Health Rankings and how you can use it to inform your work.